This is the cover page for our group presentation. Our chosen topic is using cannabinoids in pain management. Before diving deep into the topic of using cannabinoids in a pain management setting, we must explore the definition of pain. Pain is defined as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. There are two main types of pain, acute and chronic pain. Acute pain can be correlated to direct tissue damage. This type of pain is a physiological process which is essential for healing. Chronic pain usually exists longer than the predicted healing timeline and does not positively contribute to the tissue healing process. Now let's discover how does cannabinoid works in the body. The route of administration plays a significant role in the absorption of cannabinoids. Smoking or vaporizing cannabis allows for rapid absorption into the bloodstream through the lungs. Peak plasma concentration of THC and CBD are achieved usually within 3 to 10 minutes, with bioavailability ranging from 10% to 30%, 35% for THC and slightly lower for CBD. For oral ingestion, slower onset of effects and lower bioavailability compared to inhalation. Peak plasma concentration are reached usually 1 to 6 hours post-ingestion. Bioavailability of approximately 4 to 20% of THC and 6 to 19% for CBD. For sublingual ingestion, the bypasses first pass metabolism, causing a faster onset and higher bioavailability compared to oral ingestion. Peak plasma concentrations are within 15 to 45 minutes, with bioavailability ranging from 13 to 35% for THC and 11 to 45% for CBD. Now, for topical application, due to the low permeability of the skin, systemic absorption is limited, resulting in a minimal psychoactive effect. Cannabinoids are highly protein-bound and distributed all over the body, with a particular affinity for lipid-rich tissues. THC and CBD can easily cross the blood-brain barrier, supporting their psychoactive and therapeutic effects on the central nervous system. The volume of distribution for THC is estimated to be 3 to 8 litre per kilogram, while for CBD it ranges from 32 to 45 litre per kilogram. Cannabinoids are primarily metabolized in the liver by cytochrome P450 CYP enzymes. THC is mainly metabolized by CYP2C9, CYP2C19, and CYP3A4, while CBD is predominantly metabolized by CYP2C19 and CYP3A4. These enzymes convert the main compounds into a number of active and inactive metabolites. THC is metabolized into the psychoactive 11-hydroxy-THC and the inactive 11-nor-9-carboxy-THC. Cannabinoids and their metabolites are excreted through the urinary and fecal routes. Approximately 20 to 35% of the THC and CBD metabolites are eliminated in urine, while the remaining 65 to 80% are excreted in feces. The elimination half-life of THC ranges from 1.3 to 12.6 days, while for CBD it varies from 1.4 to 10.9 days.
So now we're going to talk about the mechanism of action. Cannabinoids primarily bind to CB1 and CB2 receptors, affecting the release of neurotransmitters, regulation of immune responses, and cell signaling pathways. They can also interact with other receptors and ion channels, resulting in a wide range of effects on the body. Endocannabinoids act as neuroregulatory modulators by being released by one neuron and binding to the receptors on another neuron, affecting the release of neurotransmitters. Different parts of the central nervous system have varying psychotropic effects when cannabinoids, specifically THC, bind to them. These effects can include impaired memory in the hippocampus, impaired judgment, and sensation in the neocortex, altered reaction time and movement in the basal ganglia, increased appetite in the hypothalamus, euphoria in the nucleus accumbens, panic and paranoia in the amygdala, and ataxia in the cerebellum. Adverse effects of cannabinoids ranging from mild to severe. Common side effects are typically associated with recreational use, such as euphoria, anxiety relief, increased heart rate, changes in perception, increased hunger, dry mouth, and red eyes. However, more severe symptoms can also occur, including panic attacks, muscle twitches, psychosis, excessive vomiting, injuries from inhaling, respiratory conditions like acute respiratory distress syndrome, and bronchospasm.
Medical cannabis is no longer limited to inhalation, as various administration forms have emerged in recent years. Thus, healthcare providers need to stay informed about the various methods of administering medicinal cannabis to ensure safety. For smoking cannabis as a route of administration includes using pipe, bong, spliff, or joint. Smoking cannabis is one of the most popular route of administration. However, it is not recommended due to high combustion temperatures, usually around 600 to 900 degrees, that may generate harmful byproducts. Long-term use could negatively impact the respiratory system. Cannabis smoking often produces respiratory symptoms such as coughing, wheezing, sputum production, compromise pulmonary function, and bronchodilation, and acute and chronic bronchitis. Vaporization is a growing inhalation-based method of cannabis consumption that involves electronically heating natural cannabis to a high temperature to create an aerosol combination of cannabinoids and water vapor for inhalation. Vaporizers using organic cannabis extracts have identical pharmacokinetics, pharmacodynamics, and THC absorption comparable to combusted cannabis. Its vapor is primarily THC, with a small number of additional components and less carbon monoxide or additional airborne toxins, thus proposing that vaporizing natural cannabis may result in a cleaner route of administration. As a substitution for inhaled cannabis, edible cannabis is becoming increasingly popular by infusing foods and drinks with cannabis. The use of cannabis edibles is associated with a delay in the bioavailability of psychoactive substances in cannabis, thereby postponing the onset of its effect. Furthermore, consumers have a diminished capacity to regulate dosage and its consequences. Consequently, unforeseeable and possibly severe psychoactive reactions such as overintoxication may occur, especially when the substance's components or concentration are unknown. Overconsumption of edible cannabis has been reported to result in overdoses and, although uncommon, instances of coma and death. Topical creams are also available as a route of administering cannabis. Topical creams benefit dermatological and arthritic concerns. Table 1 provides a quick demonstration of the advantages and disadvantages of various routes of administration of cannabis.
So let's talk therapeutic effects. The cannabis stevia plant contains well over 400 different compounds. However, it's interesting to note that most of the research on cannabis has really only been honed on two of these compounds, THC and CBD. A research carried out by Casey and Vaughan suggests that the psychoactive compound of cannabis stevia, THC, may have some beneficial effects regarding pain relief. Additionally, it seems that the non-psychoactive component of cannabis stevia, cannabinol, may also have some anti-inflammatory, neuroprotective, anti-anxiety, and antipsychotic properties. There are mixed reviews regarding the effectiveness of this product. While some have reported noticeable improvement, others have not experienced any significant benefits. It may be worth considering individual factors and consulting with a healthcare professional before making such decisions. In this slide, we're looking at a table of summaries of studies being done on different chronic conditions and the different types of cannabis that was used. Based on recent evidence, it appears that cannabis may have a positive therapeutic effect on chronic non-cancer pain. However, there is still insufficient research to determine which patient would benefit from cannabis treatment, the best delivery methods for cannabis medication, and when cannabis should be introduced as a line of therapy. Furthermore, studies have revealed that cannabis can have several harmful effects, and the number needed to cause harm is relatively low. Given these findings, it seems reasonable to agree with current guidelines that cannabis should not be used to manage chronic pain alone.
Now we're going to talk about contraindications. Cannabinoids can have certain contraindications, which means they may not be suitable for use in certain circumstances or with specific individuals. Pregnancy and breastfeeding. The use of cannabinoids during pregnancy and while breastfeeding is generally not recommended, as research regarding the potential risk to the fetus or infant is limited. Psychiatric conditions. Individuals with existing psychiatric conditions or a history of psychosis should exercise cautions when using cannabinoids, as these substances may worsen symptoms or trigger episodes. Cardiovascular conditions. Individuals with cardiovascular conditions such as heart disease or high blood pressure should be cautioned when using cannabinoids, as they can lead to temporary increase in heart rate and blood pressure. Respiratory conditions. Smoking and vaporizing cannabinoids can be especially risky for individuals with respiratory conditions such as asthma or chronic obstructive pulmonary disease.
Here are the references for our presentation. Here are the references for our presentation.